Hi, everyone, and welcome to our Ask Me Anything session. I'm delighted to have you all join us today. As the name suggests, this session provides you with a unique opportunity to ask our distinguished guest absolutely anything about his work, background research, science, and innovation in the field of modern lab leadership. Before we begin, I'd just like to highlight one or two important details. Firstly, this is a live session, and we're thrilled to have so many participants joining us today. Many of you have already submitted some questions when you registered, and we really do appreciate your support and your interest in this session. However, don't worry if you haven't submitted any questions yet. There is still time, as you can ask your questions during this live session. Simply enter your question into the box you see on the right-hand side of your screen and click send. So, if you have any questions for our speaker, please do share them with us. We have a team in our virtual backstage who will be ensuring that the questions asked are appropriate, so please do keep them relevant to the topic at hand here. And we will do our best to address as many questions as possible before the session concludes today. Next, if you encounter any technical issues during the session, just click the chat icon in the bottom right corner of your screen, and a member of our team will be sure to help you out. Once again, welcome to our Ask Me Anything session. And today, without further ado, it's my great pleasure to introduce our expert for today's session, Sean Tucker. Hi, Sean. How are you doing today?
I'm doing well, thank you.
So, we always like to open these sessions by firstly asking if you're able to give us a quick introduction to who you are and what you do.
Absolutely. Hello, everyone. Thank you for participating today. I'm not sure how distinguished I am, but I'm certainly willing to share with you the ups and downs of my current profession as the laboratory director of North Kansas City Hospital. I am a medical laboratory scientist certified by the American Society of Clinical Pathology in my background. Also studied molecular biotechnology in clinical practice and have been working in the clinical lab science or medical laboratory science field in healthcare here in the United States over the last couple decades. I went back to school to obtain a master's in business administration with an emphasis on healthcare administration. And since then went into operations management and then later into my current role as director of laboratory services. And so my current position is managing laboratory services for both the clinical and anatomic pathology components of our department, which is part of a 450-bed community hospital. We perform approximately 1.5 million tests per year and are a 24/7 operation. We have multiple outpatient phlebotomy operation locations, as well as servicing a region of about 31 clinics around our surrounding community, which composes of our physician network as well. And so that's basically, the operation component of what I oversee, managing a staff of about 150 people here in the department.
Fantastic. Lovely stuff. With basic introductions out of the way, we've already had some really, really good questions come in from our audience. So I'm going to open the floor up to any questions that our audience has. I'm going to start off with the question, what does a day in your life look like?
Absolutely. One thing I intentionally started off with is to assure that our administrative assistant or secretary here in the department gets to work a little bit earlier than I do to kind of get a touch of the feel between our, again, being a 24/7 operation, the shift change of scientists and phlebotomy staff that participate. And so she gets kind of an understanding, a temperature check, if you will, of what went on the night before and what is currently going on. And so that she can give me a little bit of insight of where I need to direct my immediate attention when I get in the morning. I certainly start with GIMBA. So GIMBA is a Six Sigma term of being present where the work is done. And so I continue to round on a daily basis, but I start rounding in the morning, providing there's no immediate concerns that I need to address, or I try not to schedule meetings before 9 o'clock a.m., just so that my morning can be focused with the individuals doing the work. And so I round through the department and basically assure that our daily readiness board is up to date, showing our safety measures, our supply chain, our instrumentation and equipment, our staffing, and our metrics are all up to date. And so that everyone in the department has a visual understanding of what they are getting into on their day-to-day basis. But I do as well. And so we'll make sure that that board is up to date. And again, my administrative assistant helps me update that each morning as I come in. And then as I'm rounding, understanding, what are the challenges that each department is seeing? What are some of the highlights? How can we recognize individuals for their work each day? Recognition is a daily component to not only our readiness board, but my daily work as well, to making sure that if someone has a birthday, I'm sending them a birthday card to their home. If someone is being recognized for going above and beyond, not only am I recognizing them by writing a personal letter, but that we have, a small gift card or something that we can also provide. Making sure that that is constantly part of your daily process as a leader is important, because 150 people, that's a lot of people to manage. It's important that you round on a daily basis to make sure that you have those touch points. About every week and a half to 2 weeks, I also, I might come in a little bit later in the morning, but I will stay into the later part of the evening. And this is to assure that I do have overlap with our night shift team as well. And so that makes sure that I'm also creating time and opportunity, speaking directly one-on-one with everybody on that shift, to make sure that they understand they have an opportunity to share any thoughts or concerns that they have, ideas that they want to propose. And to understand that we have a relationship of trust, that they have an opportunity to share that information as well. And so between those two time periods of the day, anything can happen in leadership. There is a city water main break that shuts down the water to the entire hospital. And what do you have to do to maintain operation on your chemistry analyzers? That literally happened last week. And so those are the sort of things that you have to be very nimble, flexible on. Prepared for, certainly, being able to kind of keep calm, because not everyone can keep calm in those situations. It's important that you do as a laboratory leader, and be able to support not only your team, but also your hospital administration in those components. And often, for this example, when incident command is activated and you're responding to a large event, it is very important that you are quite precise and prepared in order to present on your department. And so, these are the sort of things that come up. I try not to schedule too many meetings that do not get a lot done. And so if something can be handled through an email, I will handle it through an email. It is very challenging with our current staffing in the clinical laboratory to have mandatory staff meetings. So when at all possible, if I'm relaying information, we relay them during daily huddles, which are approximately 5 to 10 minutes each day. And if it's something larger than that, then I will pre-record, just like we are today, a town hall presentation that goes through those important events so that they can watch that on their own time, when they have time available. We are a 24/7 stat laboratory supporting a trauma department, a cardiac program, nonstop OBGYN department as well. It is hard to pull people out for mandatory meetings. And so we need to be more flexible and nimble in being able to provide them information when they have time to look at it and focus on it, really, and making it mandatory through a virtual format. So that's a little bit about my day. I try to fit in a little bit of lunch, a little bit of exercise when I can, and try to keep a positive environment going, managing people up throughout the day, and constantly being, certainly a cheerleader for the department.
No, it's fantastic. It's really great to hear how closely you work with your staff. I think that sort of ties into one of the really great questions that we got from our during the registration bunch, was from someone called Juan, asking how can we adapt our communication methods to effectively engage with younger generations who are entering the lab as well.
Yeah, that's a very good question, Juan, and something that I'm challenged with. I have a presentation coming up on the differences between generations, and we don't all fit in a box, right? There are folks out there, in the who have been around for several generations or several decades that are very savvy with social networking and computer skills, and so I don't fit anyone into a box, but we all have our strengths, and so understanding that there are individuals who receive information differently or communication differently or in different avenues. As a leader, you have to be able to respond to those differences. You can't just say, you have to check your emails, and that's the only method of communication I'm going to provide you for all sources of information. It's not going to be successful, and it's not going to create relationships between each of your employees and your position and leadership. And so certainly being adaptable. Things that we are doing, obviously email is a central component of an organizational structure typically. And so that is a solid component. We have electronic documentation systems for policies and procedures. If there are any required updates, those are going to be automatically emailed as a requirement into their email inbox. So our expectation is that every employee gets into their email inbox every single day, at least one time, to see what are those important requirements that need to be completed within that first day back to work, if that makes sense. And there's no way around that. But I mentioned the daily huddle or readiness board. So daily huddles are, again, when you're getting your department together. We have them in our core clinical laboratory. We have them in our microbiology laboratory. We have those in our transfusion medicine or blood bank department, and in our anatomic pathology department as well, where we're doing histology and cytology. They have daily huddles where they are meeting as a small team. Again, these tend to be 5 minutes or less. I encourage people to stand, and so that they don't get distracted by sitting or maybe doing work on the bench that might be distracting them from their huddle, because again, it should be 5 to 10 minutes, no more. That if there's any concerns or issues that take additional time, resources, or commitment, those be set aside for a conversation outside of the huddle itself. And then when kind of going through, do you have the items that you need to do your job today? Are there any safety concerns that you have? Is there anything important? Are there certain patients that we need to be aware of that could affect how we do our work during the day? And then always end with, who do we want to recognize? Who did a great job yesterday, or who stayed late this morning to help us get our workload completed or up to date, and how can we recognize them? Sometimes our departments will mix in a little bit of trivia. They'll have some trivia questions. They keep tally of points, and then they'll give a gift card at the end of the month for that person who does the best on trivia. So we try to make them a little bit fun, again, keeping them fairly short, and integrating them within each of those clinical departments to make sure that they're understanding important announcements that need to be made. Even if that announcement is, check your email, there's important information about your retirement plan changes, for example. And so daily huddles are critical. That readiness board is a visual component. So again, not everyone receives information auditory. And so having a visual component as well that says instrumentation from the core laboratory, is it green, meaning everything's good to go? Or is there a red button that says there's something going on? And then underneath it, we'll write which instrument we're having problems with. And so kind of that green-red type of visual understanding of what, again, your daily readiness is as you approach your job or your work for the day. That includes visualizing our metrics that we focus on in terms of our strategic plan for the department. Those are going to be posted and updated on a regular basis. We might have updates to our heart program. How many open heart surgeries are we expecting today, so that we can prepare our blood bank to make sure that we're having the appropriate amount of red blood cell products and platelets on our shelves. And so that critical information, are there IT updates that we need to be aware of? Are we going to experience an IT downtime sometime today? That's critical information that we also want to make sure that we are plugging through multiple avenues: email, huddles, daily readiness board. In terms of communication with staff personally, one example that I can provide to Juan is that in a 24/7 operation, staffing is constant and staffing issues are constant. And so we have had to adapt how we communicate with individuals because they're not checking work emails outside of work. When we talk about life-work balance, we can't expect them to check emails at home. And so we are implementing group text options. And so there's several different platforms out there that you can group text to individual smartphones. And so those who are interested in picking up extra shifts, if you want to be eligible for overtime or a bonus, for example, you need to be part of this group text chat. And then those options are going to be made available to you. And so really utilizing text options have been very important or integrated into our staffing components.
Yeah, it's really interesting to hear about all of the different facets of communications that needs to be considered and that are going on. And I think also sort of the flip side of that, and this touches to another question that we've had to come in, was someone asking, in this digital landscape where people seem to be perpetually available, how do you go about setting contact boundaries between you and your staff as well?
Sure. Not only just with individuals or the scientists that are performing the work, but we also have to create boundaries for our supervisors or leaders of those departments to make sure that they can balance their lives as well. And so part of that is, assuring that we have some sort of leadership coverage for as many off hours as possible. Again, I run a 24/7 laboratory operation. We have 2 night shift supervisors that are basically responsible for helping troubleshoot any issues that take place between the hours of 6:30 p.m. and 7 a.m. in the morning when our day shift leadership team gets in. And so they are basically working 7 days on and then they get 7 days off. During their off days, I do not expect them to respond to anything. That's what the next supervisor is for, right? And so again, they are just another leadership person to tackle any instrumentation problems, tackle any behavioral expectation problems, any challenges that the hospital is having, like the water main break, for example. They are going to be that first level of response, okay? If there's a call-in, all of our call-ins are required to speak to that supervisor so that they can start troubleshooting the staffing arrangements for the following shift. And so we try to manage that staffing or that leadership staffing across all hours. And that includes on our day shift as well. And so we have what we call the late shift supervisor. And so they'll come in a little bit later in the morning, but they're going to stay to help cover that gap in the afternoon when your leadership department typically goes home and kind of manage that as well. Again, they are troubleshooting the issues so that they don't have to get escalated to someone who's just left home or trying to go pick up their kids, trying to cook dinner, trying to spend some time with their loved ones, to talk about, things that are happening in life. They're being that first line of defense to help resolve some of those issues and reduce the number of phone calls for your leadership team. So number one, I think that's important. But also things that we have done, we transitioned from 3 shifts of 8-hour positions to 2 shifts of 12. And that's not unusual for healthcare related fields. It did reduce some folks' hours by, from 40 hours per week, which is a typical work week here in the United States, to 36 hours in a typical work week. And so you have to understand that they took a potential pay decrease when we made this change. But what it does create is more opportunities to spend time with your family, more time at home, more days off, right? More opportunities to take holiday or vacation. And so every time I go around, I'm like, hey, it's really, really hard to bring back 8-hour shifts and staff an evening shift, for example, with the highest turnover rate. How do you still feel about these 12-hour shifts? And everyone still tells me that 12-hour shift can be hard, but I appreciate my days off, right? And so, and understanding that when they have that day off, there's someone that will back them up and continue that excellence or that service. Now, there are some operations that don't work on that perspective, where you might need more technical expertise, bone marrow procedures, electrophoresis, some toxicology department laboratories that might have different hours of operations or expectations. Maybe you're doing batch testing where you need an expert there to be more consistently throughout the week. And when you do so, typically those expert positions might not have to work the weekend, for example, or maybe they're on call for an on-call schedule during the weekend. And so you have to get creative on how you staff those in order to make sure that patient care is covered, certainly, that you have the technical expertise at the times when you need it. But then you're also creating, compensation opportunities for individuals. And one thing that I have done to try to help manage that is create what some organizations call a weekend option pay program, into where someone commits to working your Saturdays and Sundays, consistently throughout the year. They get Monday through Friday off, right? But on those days, because they are contracted and committed to working those weekends, they get paid a different pay scale, typically like time and a half or something like that, some sort of a benefit that way. When you do so, then when you're trying to cover that weekend with folks that also work throughout the week, then their weekend rotation cycle decreases, right? So instead of working every second weekend, maybe they're working every fifth weekend, for example. And that sort of creates a better life-work balance. Again, if you have children, your children are off on the weekend, you want to be able to go to their sporting events and things like that. Creating opportunities to fit those lifestyles. Weekend option contracts can be hard to staff, but certainly we find individuals that are going back to school that like having Monday through Friday off, tend to appreciate those type of pay programs. And so trying to use different opportunities to create that life work balance.
It's some really, really interesting strategies that you're using. I should also just quickly say, as a short reminder, now that we're about 20 minutes into the session, if you are just joining us, this is a completely live Ask Me Anything session where you can ask our expert here, Sean Tucker, absolutely anything about his work, background, or any queries that you have about the field of modern lab leadership. On the right-hand side of your screen, there's a text box where you can enter your question and get me to ask it. So back to the questions we've already had come in. There's an interesting one here, I think. What skills are essential for lab leaders today, and what are the best ways to develop them?
Oh, that's good. I know that we're already 20 minutes in and we're like on question number 3. So
it's all interesting stuff.
I could go on for hours on this particular one, but certainly being flexible. You have to be able to be flexible. You cannot get discouraged when there are challenges ahead of you. My wife and I, we honeymooned in Jamaica. And in Jamaica, I was taught there are no problems, just situations. And I'm not going to try the Jamaican accent. It's because mine is terrible. But so that's kind of my approach. There's no problems. They're just situations. They're just opportunities or challenges, however you want to put them, in order that need to be solved. And you're in the position to be able to help support that. As a leader, you're not responsible for coming up with every solution. You're helped guide individuals to come to solutions, right? And so I think Steve Jobs said, you don't hire the smartest people to tell them what to do. You hire the smartest people to tell you what to do. And that's the kind of culture we want to develop in our laboratories, right? We are scientists. We are highly trained and capable individuals. Maybe not everyone has the social competency in order to be able to manage complex situations or projects on their own. But that's where the leadership comes in. And I think that's an integral component, is it allow everyone to live up to their opportunities or their strengths and help guide you as a leader into what solutions you're going to have for your situations, if that makes sense. And so there's a lot of information on emotional intelligence. I think that's important. There are personal preference evaluations like DISC or DISC, and others out there. Strengths Finder is one great opportunity to understand individuals' strength components and how they can merge together to find solutions. PROSCI, PROSCI management is great in terms of better understanding project management and how to be successful in project management. These are tools that I have certainly used. And then I would really look into what your leadership style is. And I've been, focused on leadership development for now probably 10 or 15 years. And the style that I have gravitated towards is a servant leadership style. And so there's a lot of books and information out there about different types of leadership. But specifically in healthcare, in our field, where we are serving our community, we are serving our patients. We are looking for zero harm and positive outcomes, surrounding ourselves by intelligent individuals who are highly capable for performing these outcomes. I found that servant leadership style has worked for me the best, and I would certainly have everyone look into what that means and do a little bit of additional education there. I don't know if anyone is I'm sorry, I'm from the United States, a soccer or football fan. There is a funny little show called Ted Lasso. He exemplifies servant leadership and how he approaches complex situations, which is kind of a funny way to kind of put that around there. And so kind of find your own story, where you're coming from, and then be authentic. I think scientists are quick to understand who is authentic and who is not authentic. And so we have to be cautious about certainly being overconfident as we approach complex situations. Again, that's why you surround yourself by experts, and you allow them to be part of that solution-driven opportunity. But also, you have to be confident enough to manage a project and making sure that it's completed on time, and that you're reminding individuals of what components need to be completed. And again, that servant leadership style approach has allowed me to be the most successful in doing so.
Really interesting. Thank you so much for that answer. We've got another couple of really good audience questions in here, quite a lot on the theme of sort of like technology innovation. So I'm going to pepper a few of those at you right now, if you don't mind.
Sure.
Apologies if there's any background noise there. So the first question I have here is from Nuhum. Apologies so much for the pronunciation as well. It's not going to improve. But they ask, what does lab of the future mean compared to past and present labs?
Yeah, that's a great question. And I think we're starting to see slight components of it. We have already seen automation integrated within our laboratories over the last several decades. And so we are going to continue to see automation being part of specifically the clinical laboratory. I would imagine the future part of the research laboratories as well. Research is a little bit different, and my background is healthcare related, so I'll probably more focus on the clinical components. But certainly, at least in the United States, staffing shortages are going to be one of our top two major issues in the upcoming decades. And so automation will have to be part of the solution to our staffing shortages. We are expecting approximately 30,000 retirements in the next few years, with about 10,000 graduates replacing them. Now, that number varies a lot, and it might be a slightly changed from the last time I looked into it, but basically significant shortages are going to be affecting our departments. And so automation has to be part of that. I think we've seen a lot of consolidation here in the United States. So again, we are in private healthcare versus a public government structure in healthcare. These things change a lot, but we're seeing a lot of consolidation of laboratories to where esoteric or very specific department or expertise are being consolidated into one centralized location, and then general testing remains operational in these healthcare locations, especially the rural areas, et cetera, smaller facilities. So we're going to continue to see some of that consolidation of expertise, primarily microbiology, histotechnology, cytology. We'll see what happens. In the United States, we're seeing a huge vacancy of cytologists that are trained. And so that'll be certainly interesting, as well as pathology as well. I would imagine that if you are managing outpatient phlebotomy locations that might be tied into a pharmacy department or a physician practice, that you will see a robotic phlebotomist in the upcoming years, which are basically, ultrasound guided robotics that are experts in obtaining, blood through a venipuncture procedure. And so, I think we'll start to see those expand as they become more affordable in the market, to help take care of some of those venipuncture procedures at satellite locations, right? Throughout the communities. We focus on, healthcare being a convenience for individuals. When they're having all of their groceries delivered to them, they want their healthcare delivered to them as well. And so making things certainly adaptable and more convenient within their communities is going to be an integral part moving forward. I think that's where some of this robotic phlebotomy can be valuable for the laboratory. We're starting to see the use of drones for laboratory specimen transport, specifically for our organ donation transplant network group. They are sending blood specimens using drone technology for HLA typing to, again, a very highly centralized, specialized laboratory that has been consolidated into one location so that they can get potential donors blood tested from very rural areas. The United States is very large, as you all know, and so some of these rural areas are 5-6 hours drive away from an HLA or transplant service testing location, and so they were trying to find new opportunities using drone services in order to get those blood specimens to them quicker. And then there's the whole elephant in the room around artificial intelligence, and certainly artificial intelligence is also going to have to help us become more efficient. Artificial intelligence will not replace the scientists. They will not replace the pathologists. They will not replace the cytology needs that we have in our department. What they're going to do, what it will allow us to do, is be more efficient with the work that we're doing and make the work safer. Again, zero harm is our goals in healthcare, and we are, experts in data, right? So I always tell individuals who do not work in the laboratory, we are just a data company, right? We are providing data for healthcare providers to provide information that will assist with probably over 70% of their diagnoses for their patients. And so, everything else comes into the laboratory, whether it's, biohazardous or what, but our output is always data. And so how do we manage this data as the data increases, right? As we start to integrate genome testing into our historical patient records, how are we mining this data efficiently to better understand the quality of results that we're trying to report? And so, again, being in the United States complicated healthcare environment that we are, there are different types of IT systems that every single hospital is using. They do not communicate with each other. And so a patient's record can be different from one state to the next as they move for their job, for example. And so I think they're starting to look on how we can code this so that they can be integrated in some sorts. I think we're going to see that expand, and then be able to use artificial intelligence to be able to mine that data, again, from their previous hospital when they lived in Seattle. Now they've moved here to Kansas City, where I work, and there's that, trying to make that connection. I think we're going to have to be able to utilize artificial intelligence to mine that data to say, okay, why am I seeing this abnormal result? Help me make sense of it. And then going into genome testing, and it's really interesting as well, because there was a great Seattle Children's presentation yesterday where they were talking a little bit about the idea of free genome testing, right? Or 23andMe genomic testing that tells you a little bit about your ancestry, or what is the probability of you getting Alzheimer's or something like that. Testing is not free, and they made that apparent in yesterday's presentation, and that's true. But what we are seeing is some of these privatized companies, what they're doing is they're supplementing or taking on the cost of this very expensive genomic testing so that they can sell this data. Of course, it's going to be removing all patient information, right? But selling this data back to pharmaceutical companies so they can come up with new cancer research drugs and other drugs to help facilitate outcomes. And so, there's certainly a cost for that. Now, will the long-term benefits be outstanding? Hopefully we can cure cancer, right? And that's the end goal. So understanding how we're going to mine this genomic data is incredibly important. And I think, privatization is going to have to be part of that component. It can't just be academic or public run, because there's not enough funding in there to push that research long term. And there's just so much data that you have to be able to mine through. So artificial intelligence will certainly be a component of that, as our biostatisticians will help kind of connect those dots and help us better understand as we get more genomic results from across a more diverse group of individuals around our world. That's when we're really going to see positive outcomes and results. I think right now we're too isolated in terms of what genetic data we're actually looking at. We're not seeing a full diversity within the genomic data that we're trying to mine as that continues to expand, and we provide access to individuals in different parts of the world, especially those who are impacted by economic disparity and certainly healthcare disparities, integrating their data into this and allowing, again, optimizing artificial intelligence to help us mine this data. We'll start to see some really positive outcomes in the next 10 to 20 years.
Really cool stuff. Thank you so much. And I'm glad you brought up the topic of artificial intelligence as well, because I'm sure it's a surprise to no one to learn that that's come up a few times in our audience questions. So we have a question here from Claire, who asks, as a leader of an organization, how do you find balance that assures your staff on AI adaptability in the work or lab space?
Yeah. Funny enough, my staff aren't terribly concerned about artificial intelligence. I think they understand that on a daily basis. They understand their importance. We have started to see components of artificial intelligence already in the clinical laboratory, mostly in terms of digital slide scanning and cell identification. And so I imagine, several of the folks on this call have already experienced technology that is out there on the market that are digitally scanning slides and identifying cellular types and categorizing them based upon rules that are built in the computer system. And so, those are already integrated into our daily work. And so, understanding that and really understanding that it is a tool is really important moving forward. And just like our smartphones are a tool, that's one thing I struggle with as a laboratory leader is how smartphones are just integrated into our lives. So do I allow my staff to use their smartphone while they're at work, or do I disallow that? And that's something, certainly as a leader, we will all grasp with, or we will all be challenged with. But essentially, it's a tool. It's everything from a calculator to a camera. Our chemistry instrumentation has these clear screens on the front. You can actually put your camera up against it, and then you can zoom in to see what's going on inside the instrumentation, to see if there's some sort of a jam in there, if it's a probe that's bent. And so you can only use your smartphone in order to be able to do that. Otherwise, you have to wait for the whole instrument to come on pause, which might take 20 or 30 minutes if you have an immunoassay going on, before you can open up the lid and investigate yourself. So how am I to say that you can't use your smartphone during the day if it's an integrated tool in order for you to do your job? So artificial intelligence is just going to be one of those additional tools that support us in order to do our work. Now, as laboratory leaders, we are only capable of introducing artificial intelligence as it comes out in the market. And at least in the United States, the Food and Drug Administration, as well as our federal government Center for Medicare and Medicaid Services, kind of decides what can be allowed and what cannot be allowed on the market. And some of these regulations are currently changing as well. So we certainly have to be mindful of that. And so this technology has to be introduced, through regulation systems before it can become developed on the market for use in the clinical setting. And so we are, subject to waiting for that technology to be able to come out. And, there are two major providers of health information management systems here in the United States. And they are both actively working on how to use artificial intelligence in order to better understand how to pull information from a patient's medical record to support patient outcomes. And I think that's going to be critical and important as well. At least here in the United States, hospitals are accredited in certain specialty areas, whether that's a cardiac program or sepsis management, for example, or wound care. And these sort of certifications require a lot of data. I think, again, these computer models are going to help us pull that more in real time. And potentially that might be an expectation for your hospital to maintain accreditation moving forward. And so, again, we're trying to support our employees, our scientists, our providers, make them more efficient in the work that they're doing. And I think, what we might see happen first is more changes in anatomic pathology. Again, on digitization of slides and artificial intelligence to read those slides and help prioritize the work based upon categorization of the severity of illness. And so that as we develop a shortage of pathologists across, probably the globe, that you can have a pathologist working 1,000 miles away that is prioritizing my patient at my hospital because the artificial digital images have been categorized to elevate its severity or attention, if that makes sense. And so I think we'll be able to, again, provide diagnostic information much quicker, which then allows our oncology departments to provide oncology services on a faster rate, allowing those individuals to kind of get scheduled a little bit sooner. Sorry about that. And get those processes moving.
Thanks. It's very interesting to hear AI being reframed as sort of it's a tool. It's a tool that we have to learn to manage, like smartphones, as you say. Very interesting answer. And yeah, as you know, this is an Ask Me Anything session, so the topics, the questions have a tendency to jump all over the shop. So if you don't mind, I'm going to move us away from technology and back to sort of personnel management, leadership type stuff, because we have a question here from Juan. I don't know if this is the same Juan as before or a different person, but they've asked, what strategies do you recommend for maintaining team morale during periods where workload might be high and stress might be high?
Yeah, that's a very good question, Juan, and it is up and down. It's never normal, right? You know what I mean? I think people management is a sigmoidal curve. You have your ups, you have your downs, and you just try to keep an average, you know what I mean, over time. Now, I try to keep just above average, if that makes sense. And so making your uptime a little bit more than your downtime. But also, speaking of uptimes and downtimes, your instrumentation maintenance and uptime is directly correlated to employee satisfaction, right? So if you can run a quality laboratory where your technology is updated, it's working appropriately, you have good service contracts where your service response times are appropriate, having the tools that are available and the supplies that are available for them to do their work when they need to do it directly relates to employee satisfaction. Then there's the talk about how do you create a culture, right? And I go back to servant leadership, right? And so understanding that I am not here to tell them what to do. I'm here to serve them in order for them to be able to provide patient care, right? And so it's kind of a reverse structure where you empower individuals and manage them up into being the best scientists that they can be. Again, by providing the supplies, providing the tools, providing education opportunities for them, giving them a little bit of flexibility and personal opportunity to advance themselves, either pushing their skill sets into a different direction or creating career advancement opportunities for them. And so one opportunity that we have is called a career ladder, and it's based on an annual bonus structure. There's 3 different levels to that, depending on how many extracurricular activities that they perform during the year, depends on what level of bonus that they receive at the end of it. It includes everything from leadership development to quality operation, process improvement, community outreach and volunteerism, as well as maintaining certification and licensing. And so all these things add up to different point levels, which again are creating opportunities that would be outside of their normal job description, and it's volunteer only. So they understand these things going into it, and they are choosing to go above and beyond what their normal job functions are, understanding that some of that work might take place outside of the office as well, in order to kind of create career opportunities, or at least learning opportunities for them to advance in their career. Now, on a different level from the phlebotomy component, we have created a different type of career structure where our laboratory assistants might come in as a level 1, where they're just learning how to draw blood, and then at a level 2, they're drawing blood and they're doing pre-analytical processing of those specimens, right? And then at a level 3, they might learn how to plate microbiology plates, or run histology tissue processors, for example. Certainly under all the education requirements that are required by your accreditation agency. And then you would have a coordinator level, and those coordinators would then coordinate all the work and the training that has to get done for that large group of individuals, and kind of monitoring the quality of that system as well. And so creating those tiered opportunities as well, where they can grow over time. And then one last thing that we always try to do is, if they are interested in continuing education or going back to school or getting another certification of accreditation, whether it's a specialty in hematology, or maybe their phlebotomy license certification, which is not required from our job description. I want to certainly encourage them that they have the resources to study for that. So buying a book, for example, and then paying for that certification exam once they pass. And so we will give them sort of a reimbursement grant for completing that type of additional certification as well.
Yeah, that's fantastic. Professional development is obviously an extremely important thing. So it's great to hear, how you're supporting all of that. And it's also, you mentioned employee satisfaction while you were talking just there. And just tacking on from that, one of the other questions that we've had was asking how you go about measuring but also celebrating success within a lab environment.
Yeah, absolutely. Again, just like communication, there has to be multiple avenues for recognition. And so there are several things that we certainly do. I want to encourage an environment of laughter, of fun, where people can joke, of course, what's appropriate, understanding what is and what's not appropriate in terms of jokes. But that also celebrates a diverse workforce, understanding what our backgrounds are, being able to share their stories, right? And so we have, right when someone gets in here, we want to learn a little bit about them, what their background is, and share their story. And again, if they allow us to, we will share some of that information into our monthly newsletter, for example. Get to know this new employee. They have a cool story. Here's something neat about them that you can ask them about and start a conversation. And I think it's really just understanding a little bit about each of our stories that can make that connection, whether it's small or large, whether it's the school we went to or the town we grew up in or the hobby that we enjoy. Being able to make those connections allow them to start building trust. And then as you build trust, then you can start building a well-developed working relationship. And so I think the most important thing as a laboratory leader is that if you do have a new employee, you need to give them the best opportunity to start building those relationships that you can. And so allowing them to share their story, allow them to share their expertise, making those connections, introducing them to each individual. So I personally will take new employees around the entire department and introduce them by name to each person so that they can start that relationship and understand that I'm giving my time up during my day to make sure that they get to meet each one of you. And so when you build that relationship and you start to build trust, then you can start to build strong teams. And, we have surveys, employee surveys here at our facility that each year on an annual basis, they take kind of temperature checks about where our employees are, where they're feeling. Hopefully it's not just right after they have layoffs, for example, when they're taking these surveys. But you have to be able to manage the ups and downs of those departments. And again, it's not a straight line. It's a curve, and that curve goes up, it goes down, and you get to manage what that slope looks like. And so, continuing to have different avenues for recognition. Again, I send happy birthday cards to each person's home. We have a program that allows both coworkers and patients to fill out an excellence sheet saying why someone went above and beyond and why they're thankful for that person. And so whenever those get submitted, I personally write a letter to them, again, sending it to their house. I'll oftentimes put small gift cards in them, just to the cafeteria at the hospital or something like that, to just say thank you. We'll have random days where we'll just start handing out chocolate bars or candies to individuals, just thanking them for their work. During daily huddles, we always ask, who are we recognizing today? We always submit each year an employee for a hospital employee of the month. And so that is hospital-wide or organization-wide recognition. So we're making sure that we're always recognizing folks across the hospital as well. And then when we have an opportunity to be able to present the great work that we're doing in our department outside of our department, whether that is at a hospital-wide town hall meeting that's led by the CEO of the organization, whether that's in our social media channels that the hospital puts out, or our internal intranet page where we write stories. I try to make sure that, again, with permission, we can highlight the individuals that do the amazing work in our department. And finding your best friend in the marketing department is your way as a laboratory leader where you can make the best difference. And so find out who that marketing person is, be their friend, buy them a bottle of wine or something outside of work, obviously, and make sure that you make that connection, because they're going to be the one that are looking for these stories and that can highlight your team for doing the amazing work that they do.
That's fantastic. I'm sure something that's extremely, impactful to all of your staff as well. We've got about 10 minutes left on the session, so I just want to issue one final little reminder. If you have questions that you want to ask, there is a text box on the right-hand side of your screen where you can submit them and get me to ask them to our wonderful expert here. Get them in quick before we have to wrap up is all I'd say. But we do still have quite a few questions to get through, so I'll rattle those off. I think this is a lovely one to lead off with next as we're sort of wrapping things up. And that's asking, what advice would you have for early career scientists who are aspiring to become lab leaders themselves?
Yeah, that's a great question. One thing that I have always done is try to put myself in an uncomfortable situation. And I think too often we will just go down our one lane road and be quite comfortable with it, and we don't detour to explore new opportunities. Try to detour as often as you possibly can, within reason, certainly. And that's both within your professional experience as well as within your personal life as well. I think some of the best leadership advice I got is through failing as a parent, right? And learning from that experience, and taking that experience as a husband, and how communication works well with your spouse, how communication breaks down with your spouse, learning from those types of opportunities. It doesn't have to always be in the laboratory where you develop your leadership skills in order to become a leader within your department. And so finding out, what is your story and stick to it. You have to be genuine. You have to be truthful. You have to be as transparent as you possibly can be. Obviously, I'm not telling everyone my dirt and the ghosts in my closet, right? They don't need that tea. But I am being able to provide truthful information about my life experience and how that might relate to them within their current roles, right? And so put yourself in uncomfortable situations. One thing I do is I go to a barbershop that is not on the same side of town that I live in. And I have been committed to that barber for a long time. And I have met people that I would have never met around where I live by going to that barbershop. You know what I mean? And so again, whether that's through travel, whether that's through meeting friends, whether that's through dating, make sure that everything's safe, obviously, but put yourself into situations that make you a little uncomfortable and see where that pushes you towards. I guarantee you're going to learn from that. And then you're going to be able to take these stories, you're going to be able to take these skill sets into that next level into management and leadership.
It's a great answer and great advice. Thank you. Since we've just had a very wholesome answer, I'm going to ask you something a bit more challenging. Apologies. But we have had a question come in of someone asking what the biggest challenges facing laboratories are today, and how are you looking at addressing these moving forward?
Yeah, I think we touched base on one a little bit earlier regarding staffing. Staffing and employment will continue to be a challenge because of our highly specialized field and the specific pathways that you need to take in order to be credentialed in order to work in our field. So automation, artificial intelligence are certainly a part of that. But what we have been focusing on, and what I have been doing for the last 20 years now, is going into high schools and even lower than high schools, middle schools, and even at the elementary level, and talking about our career field, to make sure that if you're interested in science or you're like math, to understand that we work in this laboratory and we work with blood and we have these cool things that are going on, to make sure that they just remember that it's not just a nursing degree or a physician's degree that are your only opportunities in healthcare. There is this whole world of health sciences that you can participate in, and laboratory is one of those. and just get, all they have to remember is laboratory, right? Like laboratory medicine, right? Those two words. And the United States has been trying to standardize how we call what we call ourselves, medical laboratory scientists. Trying to get the word tech or technician out of there because it's too generalized across the healthcare field. And so I'm still struggling with this, but I'm trying to make sure that anytime I speak to somebody outside of our department or outside of healthcare, that the individuals that work for me are scientists. They are scientists. They're here. They're trained in science. They took a lot of science classes. They are scientists that are working in a laboratory. So those are kind of the two connections that I try to make for younger kids as well, even in the middle school and high school levels, ages, anywhere from ages, 6 up to 18, 19 here in the United States before they get to the college level. Once you get to the college level, it becomes challenging to change your degree. And at least in the United States, it becomes very expensive to change your degree. And the return on the investment might not be enough for them to be able to change into laboratory management, or I'm sorry, medical science in the laboratory. And so you have to get them at a younger age. So that's in regards to staffing. The other challenge here moving forward, and this might just be, well, it's probably a global problem, but specifically in the United States, is how we reimburse testing. Where is the revenue going to be coming from, and how is that changing? Knowing that we are a mix of privatized laboratory for-profit systems that are publicly traded on the stock market versus small little hospitals that are trying to manage community care, right? And how are we, competing against one another in order to provide high-quality results that are affordable to our patients, and so to minimize the out-of-pocket costs that go down to our patients. And so managing those structures, as well as how our government insurance, what in the United States, that's Medicare, and from the state level, Medicaid, and how we get reimbursed from those. And then managing all of the different insurance plans and those negotiated contracts, and how much they will be scheduled by each individual code or test to reimburse our laboratory for that testing. We have to be able to cover the cost per test. That includes all of your employees, their benefits, the lights that you turn on. Those all have to be included in that cost analysis to see if we can afford to perform the testing in our laboratories. What we get reimbursed drives what testing we can perform. And so being able to advocate, on the national level to our government structures to say, hey, these are the gold standard tests that we need to start performing for this diagnostic information to help support our patient outcomes. Essentially, if you invest in the laboratory, which is 5% or less of the overall economic components that make up healthcare, we can have incredible outcomes on long-term patient healthcare impacts. So if you want to decrease diabetes in your community, if you want to decrease cancer or speed up cancer diagnostics, if you're looking at community health to see if we can improve or decrease the amount of smokers in your community to prevent lung cancer, laboratory is here to be able to help you provide that information. And so if you invest in us, we are going to be able to save you long-term money, and making sure that they understand that impact. So one example that we're doing here currently in the laboratory, and I'm sorry we're on the last minute, but is looking at new microbiology identification technology that allows us to diagnose an infection sooner so that we can get them on the appropriate antibiotic therapy and discharge them from the hospital as quickly as possible, safely. Because the quicker you can discharge a patient from the hospital safely, the sooner your opportunity to have a new bed open is available, right? And at least in the United States, we get reimbursed based upon one patient stay, not how many days, but just what they are diagnosed for. And so, again, managing those challenges with reimbursement is kind of the next thing that keeps me up at night.
Mm-hmm. Well, thank you for that. And thank you, Sean, for joining us today. Unfortunately, we will have to conclude our session there just due to time constraints, but it's been an absolute pleasure speaking with you.
Thank you.
And from the looks of our comment section, everyone else here has really enjoyed it too.
Thank
Don't forget that Sean will also be appearing at our Modern Lab Leader online symposium next week with his talk, Generational Leadership, Be a Leader of Generation Across Generations. This event is free to attend, so if you haven't already registered, make sure to stick around at the end of this session and you'll be redirected to the sign up page. And just before we wrap up, I'd like to ask all of you a quick question in return. Did you enjoy this session? You can let us know with a form that will shortly pop up on your screen. but time has really flown by. We've received so many great questions we would have loved to ask, but you know what they say, time flies when you're having fun. This AMA will now be made available on demand, so if you have any friends, family, or colleagues who might be interested in what we've talked about today, please feel free to share the link with them. And once again, thank you all so much for your time and participation, and thank you, Sean, for giving us your time today.
Thank you, everyone. Have a great day.